Lymphedema is a condition that can be caused by treatment of cancer due to having lymph nodes removed by a surgeon. This is most common in breast cancer, where the lymph nodes might be removed around the area of the armpit, or in cervical cancer or prostate cancer, where lymph nodes can be removed in the groin area by a surgeon. Lymphedema by definition is a damaged lymph system which causes swelling and fluid collection either in an arm or in a leg. And the prognosis for lymphedema is not good. There's no way to repair damaged lymph nodes. So imagine, if you will, having had cervical cancer and having had the surgeon remove part of or all of your lymph nodes in the area, and starting to get a condition where your leg swells to 2 to 4 sizes the other leg. This is a condition that is not considered a disability by the US government. I have a friend who this happened to, and it really pretty basically ruined her life for several years until she got it under control and found the help that she needed. So the problem with her was that her right leg was swelling to 4 times the left. As a yoga therapist, I'd like you to stand, and I want you to feel your right leg and begin to imagine that your right leg is becoming heavier and larger than the left leg, that your right leg is becoming 2 to 4 times the size of your left leg. Feel that heaviness in that leg, and then begin to notice your SI joint, your pelvis and hips, your spinal column being pulled down by the weight of this one leg. And now opening your eyes again, begin to think and feel into this condition of lymphedema. It can also happen to breast cancer patients, where lymph nodes are sometimes removed and they'll have a swelling of one arm. You may have seen breast cancer survivors that have a compression sleeve on their arm. This is one of the treatments for lymphedema is compression. Light exercise used to be discouraged with this condition, but they're finding it more and more helpful in their clinical studies. What can we do as yoga therapists? Well, in the case of my friend that had lymphedema in one leg, things that were useful to her were Vipriti Karini Mudra, putting legs up the wall. Obviously, depending on how large the leg is and the physical condition of the client, you may need to assist the client to get into this position. You'll want the hips slightly raised so that there is no blockage of fluid in the hips. A bend in the hip, in the knee, in the foot is not good for these clients. They need a free flow of the fluids to be able to be drained out of the area. So legs up the wall with a breathing regimen would be useful for this client. Other things that would be useful would be perhaps a psoas muscle exercise, where you're straightening and bending the leg with the sole of the foot on the floor. This exercise can be found in the psoas book. And another exercise that would be good would be to have the client draw their name or the alphabet with their feet. So keeping flexibility and nimbleness within the feet is very useful for these clients. Alangana practice is the proper practice for them, as their immune system has been compromised. The immune system is largely within the lymph system. They need to be kept very meticulously clean, and if they get injured with any kind of an abrasion to the skin, They need to take extra care in that area so that the infection doesn't spread into their body that is no longer prepared to deal with these problems. Other symptoms can be like a tightening or burning of the skin, a hardening of the area that's been filled with the fluid. Long enough practice with lots of breath, legs up the wall, some very gentle movement, and keeping the feet mobile would be important if the problem were in the leg. That is what I have to offer for you on lymphedema here tonight.